Good evening and welcome to the show. The show is Comments with Dr. James Haney. The topic tonight is Meharry Medical College, and we're talking to the president of Meharry Medical College, Dr. DSatcher. And Dr. Satcher, let me welcome you to Comments.
Well, thank you.
Dr. Satcher, Meharry Medical College has played a very, very important part in terms of its role in health care throughout America. And since we've decided to devote the entire program to Meharry, we would like for you to start us off by giving us some information in reference to the history and the significance of Meharry Medical College.
Well, I'd be pleased to do that. As you know, we just celebrated our 114th commencement at Meharry. Meharry was founded in 1876 in this community. Founded, you know, a few years after the Civil War, a few years after slavery. And it was founded primarily out of concerns for the underserved population of Nashville. At that time, Nashville had one of the highest death rates in the country, primarily related to malnutrition and infectious diseases. So the motivation for the development of Meharry was, in fact, the dire condition of former slaves and the offspring of former slaves, as reflected in Nashville, Tennessee. The United Methodist Church, then known as the Methodist Episcopal Church, played a very key role in the development of the institution under the leadership of Dr. George Hubbard, for whom Meharry Hubbard Hospital is named. But Meharry's mission from the beginning has related to access to health care for the underserved and access to health professional education for a group of people who many times would otherwise not have had that access. In fact, Meharry, as a medical school, was founded as a part of the old Central Tennessee College. Now, Central Tennessee College started in 1866, but in 1875, a group of students came to Dr. Braden, who was then the president, and they in essence said, we appreciate Central Tennessee College, the fact that we can learn to be teachers and preachers and pursue other fields, but we really are concerned about health care. And we'd like for this institution to have a program to train people to be physicians and nurses and dentists. And Dr. Braden listened to those students. And 1 year later, the Department of Anatomy and Physiology started at Central Tennessee College, which was the forerunner of Meharry Medical College. Now, it so happens that today, Meharry Medical College is the only surviving component of the old Central Tennessee College.
Very good. And so its very beginning, its very founding, had as an idea of access for public health.
Exactly.
And I think that that is something that you've continued in terms of its tradition, is it not, Dr. Satcher? As a matter of fact, quite recently, you wrote an article that we'd like to talk about now, dealing with access to health care. One of the things that we find as a problem in the state of Tennessee is that so many of our counties do not have adequate health facilities and et cetera. So why don't you speak to the whole question of access and what Meharry is doing in terms of trying to meet access?
Let me just back up for 1 second. In 1980, the Robert Wood Johnson Foundation did a report on Meharry Medical College in which it looked at its history. And among other things, of course, found that it had graduated more than 40% of the black physicians and dentists who were practicing in the United States at that time. But even more importantly, it found that 3 out of 4 of Meharry's graduates were practicing in underserved communities. And that means 75% of our graduates, that's 5 times more than the graduates of other medical schools practicing in these kind of communities that you're talking about. There are many communities in the country, rural South, urban North, where the only physicians or dentists there are graduates of Meharry Medical College. Tennessee today, I think, reflects a very terrible situation in this country in terms of access to care. Despite the fact that we spend more money on health care than any other country in the world, 11% of our budget, more than $600 billion last year, 37 million people in this country don't have access to care. They are uninsured. 30 out of the 92 counties in Tennessee fall under what the federal government calls underserved communities because of the absence of health care. There are counties in Tennessee where a woman has to travel 70 miles to find somebody who will deliver a baby. So right here in Tennessee, I think we reflect a serious national problem in terms of access to care. And that is a problem which Meharry, throughout its history, has attempted to target. We wish we could graduate more people so that we could have even a greater impact on underserved communities in this country and throughout the world.
Now, in terms of Meharry's role in dealing with access, are there any programs on either on the local level, state level, or the national level that could perhaps deal with this whole question of bringing more physicians into the rural areas?
The major program at Meharry, even though there are a lot of programs at Meharry that attempt to deal with access, we have what we call the Area Health Education Center program at Meharry, where we not only have put together a network of physicians who practice in underserved communities, we get our students in those communities while they're still students. The idea is to try to attract them to these communities, to make them both comfortable and competent in serving in underserved communities. So the AHEC program, which is now throughout the state of Tennessee except for East Tennessee, our AHEC program is all over Tennessee, West Tennessee, and we're now working to start a program in East Tennessee.
Dr. Thatcher, I think one of the great problems, and we've talked to other education leaders quite recently, and one of the problems that we have is a decline in number of people who are involved in education, especially medical education, law, and et cetera. What is Meharry doing, or is this decline in number impacting upon Meharry, and if so, how, in what way?
I think in general, especially in terms of black educators, there has been a decline, even though it's more extensive than that. Meharry, since the early 1970s, has had a graduate program. So what most people don't know is that in the last 10 years, Meharry has graduated more than 10% of all of the blacks who received doctorates in the biomedical sciences. Physiology, biochemistry, microbiology. We've graduated more than 10%, including last Sunday when we graduated 5 more people with PhDs in the biomedical sciences. So we're working with that. We're also trying to attract more students into education. We have a special program now which we call the Medical Scholars Program, where we encourage students who are in medicine or in dentistry or other fields to also pursue research careers and other things that would make them involved in education in later life.
Well, during the same segment, Doctor, let us say something about Meharry's effort in terms of dealing with teen pregnancies.
Yes.
I think quite recently it was learned that not only Tennessee but the entire South is suffering billions of dollars because of this problem. Now, Meharry has received distinction quite recently in terms of its programs dealing with teen pregnancies, and perhaps you would like to say something about those programs.
Well, we're very proud of the award that we received. The American Medical Association, which is the largest association of physicians in the world, last week in Chicago gave Meharry its highest award for community outreach because of its teenage pregnancy project. That project started at Meharry 3 years ago. We called it I Have a Future. It's located in a housing project. The reason we call it I Have a Future is because we don't believe that teenage pregnancy is the problem. We believe teenage pregnancy is a symptom, just like drug abuse, just like violence. It's a symptom of a group of people who really don't have a lot of confidence in the future, and therefore they don't see any reason to delay gratification or to preserve themselves for the future. So we felt that we should deal with the problem and not the symptom. So I Have a Future educates young people about sexuality and things like that, but also helps with job training, tutors them in school, tries to keep them motivated for the future. And we believe in time that's going to have a great impact on teenage pregnancy than all of the other kinds of programs that exist in this country.
Well, very good. Dr. Thatcher, we're going to have to take a break now, but after we come back, we want to talk about the proposed merger between Meharry's Hubbard Hospital and General Hospital.
Okay, very good.
We'll be back with you following this commercial break.